without further ado, it's my great pleasure to introduce my guest this evening. We have Emily Floyd, who is Clinical Director at Rossdales. Based in Newmarket, Emily has a client base that inevitably includes a high proportion of thoroughbreds. In 2012, she became an RCVS specialist in equine medicine. She has also been recognised as a specialist by the Royal College of Veterinary Surgeons. Put my teeth in. And Emily also has a keen interest in veterinary dermatology, and in 2025 she was awarded the certificate in advanced veterinary practice in veterinary dermatology. Another reason for this webinar is that Emily is undertaking a huge challenge in February next year, and we're going to hear more about that later. So we really want to help support and raise awareness of the wonderful charity that's behind that challenge. So looking forward to hearing more on that in a bit. Alongside Emily, we have Lou Robson of Thoroughbred Dressage, who's done so much to champion the retraining of thoroughbreds in particular and giving them careers after racing. Lou has thousands of followers on her social media pages, who I think are probably all attracted to her honest and straightforward approach. She also trains for the late Queen King, which I guess adds a whole other level of pressure. And we're also delighted that Phil the Farrier Pierce is joining us too. So Phil is Lou's farrier and is going to talk about obviously hoof quality and shoeing, particularly in the context of managing thoroughbreds. Also behind the scenes, she's off camera at the moment, is Katie Reeve, one of the team from Dengie. So she's going to be helping out asking questions. So if you do have any questions, pop them in the chat box or the Q&A, and we'll try and get to them throughout the evening. But as we have a large audience, I expect there's going to be quite a few questions. So the aim of this evening is really to have a discussion around the different aspects of caring for a former racehorse and a thoroughbred more generally. There's lots of great case studies and slides to share, and we have a wonderful panel, so do get involved and give us your feedback and experiences, as well as asking questions of our panelists. So to get started, I think probably my opening question to you all is, which are the most sort of common problems that you see with horses that are coming out of training and potentially being rehomed? Lou, I don't know whether you want to start us off with that one.
So common problems that I see. I see mismatches happen a bit. I don't want to talk too negatively because I do see wonderful partnerships, but I see mismatches, and so therefore potential labeling of these horses of like, well, it does this because it's a thoroughbred. So it has bad feet because it's a thoroughbred. It jumps up and down when its feet touches grass because it's a former racehorse. So that's I see quite a lot of. I see quite a lot of horses that are obviously naturally upside down, inside out, built all the wrong ways, and people kind of maybe potentially getting a little bit frustrated with like, why is it not happening like yesterday? Because social media says that you can transform these horses in 3 days from like racetrack to going and doing like an elementary dressage test and jumping around a 1-star event track. But I really like, you then see the kind of, I suppose, common problems of kind of their bodies, of possibly tendon injuries, kissing spine ulcers, which again can associate to the whole picture. But yeah, I actually really love seeing the transformation of these horses, and I love seeing them when they turn up. You never actually know how they're going to develop, and I think it's really, really, really exciting. And it's the thing I really love the most, is like watching these characters develop and kind of bloom in front of your eyes, and the horse also finding out what they love and they enjoy. And it's really, really like, it's a great journey to be on. Like really, really cool. Really cool.
Brilliant, thank you. Emily, what's the most common sort of problems that you would see?
So personally, gastric ulcer is a big one, obviously, because of the job I do. So that would be the thing I personally deal with most. But I guess the other group of horses that I deal with the most commonly, which are going to be a subset of what Lou deals with, is those horses that have come out of training, and as they start that sort of rehab work journey, they start off by going okay, but then they run into problems at that like 2 to 3 months sort of time, where actually they haven't built enough condition, enough top line, all those things. And then all their other underlying musculoskeletal things start to become apparent, and they're often behaving badly because everything is not all conjoined into one. And I guess that's the other most common thing that we see.
Perfect. Phil, did you want to comment on anything at this stage in terms of hoof quality?
Yeah, I think it's just mirroring what everybody else said. You know, I think patience is the main thing with thoroughbreds, isn't it? It's just having the patience and waiting for them to settle down and settle in, and to bring them into work, back into work slowly, making sure that they're correct in every manner, because we all know that every aspect causes hoof problems. So it's just ensuring everything's going well.
Brilliant. Okay, well, I think, Emily, if you're happy to kick us off with a bit more information on sort of gastric ulcers and what we can do to help these horses transition from perhaps racing rations through to when they enter a different career, that would be great.
So can you see my screen okay? Is that all right?
Yes, perfect, thank you.
Yeah, so Katie asked me just to start off by talking a little bit about gastric ulcers, as that is definitely something that we really, consider as a big part of a problem in racing. So obviously it still becomes a problem as these horses transition out of racing. So I've just got 2 or 3 slides at the beginning, a little bit about the background to ulcers. So this is the inside of a horse's stomach. So the top part is what we call the squamous part. So that's the part which is kind of like an extra reservoir. It doesn't produce acid, it's where all the extra sort of food is stored. And the bottom part is the glandular part. And that becomes really relevant because when we look at the different problems that horses have, they tend to occur at different times, and we also need to treat them differently. So this is a normal horse's stomach. So if you do a gastroscope on a normal horse with a really beautiful stomach, this is what it should look like. So that top white bit is the squamous mucosa. And then that line in the middle is what we call the margo mucosa, which joins the 2 parts together. So in the pink part is the glandular mucosa, which is the part of the stomach more like ours, which produces acid. And as we drive on through into the opening, that's the lesser curvature of the stomach there. And as we drive on through, we're going to get to the pylorus, which again, this is all the glandular mucosa when we talk about glandular ulcers. And then that big black hole you see in the distance is into the horse's small intestine. So when we think about gastric ulcers, it is important that we divide it into the 2 parts. There's the squamous part, the white part of the stomach, and the glandular part, which is the pink part. And the reason why this is particularly important is because squamous ulcers are much more common in horses in training than the horses coming out of training, whereas glandular ulcers are generally much more common in horses in ridden work for other reasons, so dressage, and other disciplines. And so especially as we see these horses transitioning from one to the other, we often will see a different appreciation of ulcers at different times. So if you think about what a horse should naturally do, and it's been a long time since a thoroughbred did this, I know, and this ponies out in a wicker veterinary, but what they should really be doing is browsing on scrubby land, eating forage all day. And as if you think about what the stomach looks like in a horse that eats lots of forage, this is a horse that wasn't that well starved. You can see all that forage makes a big ball of food. And the effect of that is it buffers the acid in the stomach. So the stomach has to produce acid to digest food. It's really come into contact with that white part of the stomach, because that white part, like I said, is kind of an extra storage there. Think about the pH. At the bottom of the stomach, it should be really acid. And at the top, because of all that buffering and all that food matter that should be there, we find that by the time the pH of the stomach gets to that mid portion, it should be quite neutral. So the reason we get squamous ulcers is when we're getting acid touching the top part of the stomach, simplistically. So if we think about all the reasons why that happens, obviously the most obvious reason is that you have a horse that doesn't have a lot of forage. And so you're not getting that buffering effect of the forage, you're not absorbing the acid in the stomach. So that's the first thing. The other thing that we'll see is horses that are having a lot of grain, a lot of concentrate feed. Again, that makes them produce more acid. Horses that are stressed, which are not eating well and not obviously buffering. And then fast exercise is a major risk. And we think about the way that racehorses are trained. They often do fast work in the morning without having eaten much in the morning. So they have a little, very little fiber in their stomach, and then they're galloping really fast. And what that does is it squashes the stomach, it compresses with exercise, and it splashes the acid over the squamous part of the stomach. So it's pretty predictable in horses that are in really fast training. If they're having these risk factors, then squamous ulcers are really common. And this is what ulcers look like. So we generally grade it from 1 to 5, 1 being normal to 5 being the most severe. You can see that horse in the bottom right's got, quite nasty bleeding ulcers. And so the question people really want to know, when you're taking a horse out of training, you want to know, does my horse have ulcers? What's the chance of the horse I'm taking on having ulcers? If you look at the different literature, it reckons up to 90% of horses in training have ulcers. I actually personally don't think it's quite as high as that. And we often do this sort of race scoping clinics where we scope you know, a spectrum of horses out of different yards. And I reckon actually with the improvements we've had in feeding and different things, it's probably closer to 50%, but certainly it's still a good proportion of horses that you know, do have some degree of squamous ulceration. If you're looking for the signs which might tell you that that's a problem, these are the general sorts of things that we think about, you know, weight loss, colic, not that common, but can happen, not eating that well, not having a great coat quality, sometimes performance related things. So, you know, not going forward under saddle, not wanting to be girthed or groomed. And sometimes people report just a change in behavior. The good thing about squamous ulcers is that because they are quite predictable, they also generally respond quite well to treatment. So there's, you know, 2 licensed products available. They're both omeprazole, which is an acid suppressing drug. They both work really well. You have to be a bit careful if you buy drugs off the internet and they're not appropriately buffered for horses, then they won't get absorbed. So it's important that you have a correct formulation. But the good thing is that horses generally respond really well to treatment, especially if you can make some other adjustments. And the other thing, obviously, that's really important is, you know, it's not just about drugs, it's also about all these things. And we're going to cover a lot of these things through it, but, you know, good quality forage, you know, when we're effectively often turning these horses away for a spell, you know, that's nature's way of healing them. And some of these will heal on their own. So it's not that every horse needs to have medical treatment for ulcers. You know, a lot of them will heal without, if you can adjust the other factors. You know, you take away the risk and the stress. But certainly treating these horses will often speed up the speed at which they heal. Katie, do you want to talk about any more about feeding now, or do you want to come back to it, or what do you want to do?
I think we can probably come back to it when we get to the bit talking about when they come out of training. And I suppose the question at this stage is when they're coming out of training, do you still find that many will actually have ulcers at that point, or is it something that you've had to sort of deal with when they've been in training?
I think certainly they would, and especially if they're quite recently out of training, then certainly a good proportion will. And you know, we say that horses can repair, and they definitely can heal. You know, the stomach's always turning over. But I guess it's also at that transition, isn't it? When horses come out of training, it's quite stressful for them in general. So there are often other risk factors at play. So that, you know, that can still be perpetuating having an ongoing problem. So certainly it's not something that just disappears at training. It's just, you know, really common at the point of them coming, you know, in training, coming out of training, and then hopefully gets less common if you get somewhere further down that journey.
And do you, I suppose another question I'd have is, do you find that trainers are actually making the dietary adjustments in training, or are they pretty much relying on the medication to do that work for them and carry on feeding them high starch rations? Is that a sort of fair assessment of it?
It's definitely very, and I'd say, so I've been in Newmarket just over 15, 16 years, and it has changed a lot in that time, and do really appreciate a difference. And when we used to scope horses, you know, 15, 16 years ago, we'd certainly find more ulcers than we do now. So I think there has been a change, and generally people are, you know, much more switched onto it. But that would also not mean that there's not a lot of use of medication as well. That definitely is very common practice.
Yeah, and I think the other factor in that is that a lot of manufacturers now produce much higher fibre, lower starch. Even what would be a racing ration is now much lower in starch than it would have been 20 years ago, which is obviously positive too. But that sort of tip of just feeding a little bit of forage before exercise has probably made quite a bit of difference, because it's not actually requiring them to do a huge amount of difference in terms of the bucket feed. It's just a thing they can do, you know, an extra sort of management strategy, I suppose, rather than having to fundamentally change the ration and what they're doing, which is probably a step-by-step easier to implement approach than saying, right, take all your starch out, take all your racing ration out and feed a high fibre diet.
One of the definite problems that we have is that, you know, even the trainers who are really switched onto it, a lot of these horses from their personality don't want to eat that fibre feed before they go out. And so that definitely, you know, like the trainers are quite switched onto it, and they're trying to do it. And then a lot of these horses, I think, because they know they're going out, they won't use it. Yes. And I think that, yeah, and that's the horses that need medication, where you can't reduce their stress, and there's still that behavioural part. And I guess when you're talking about the horses coming out of training, they're the ones that still have the problem, when they still have all those other, you know, all those other risk factors stick with them because of their personality and how they're making that transition.
Yeah. Lou, did you want to come in?
I was just going to say, I think also people have to consider the environment. So like Emily was saying, you know, she's in Newmarket. The environment in Newmarket is like you can go down a row of houses and then there's like a yard tucked in between like a row of houses. So the environment for which they've got access to of like turnout is quite, it's not because trainers don't want to turn out, it's the yard that which they have and what they can afford and how they work out of. So it's really hard, isn't it, for some trainers to try and get that balance between horses moving, horses being able to graze, horses being able to move, maybe create like, you know, they're not stressed, as it were, when they're in racing. It's always about trying to be as relaxed as possible, but they can't help it if their yard is literally tucked in between two houses and all they've got is like turnout pens. You know, they still have access to freedom of some sort, but it's not what we desire, which is, you know, grassy open fields, because for some people that's just not a possibility or a reality. Like they might have a pick of grass after they finish work, but I think environment's really key to kind of consider of where your horse has been when it's been in racing, like which trainer. And it's not a negative or a bad thing, it's just having that foresight, I think, a little bit.
Yeah, and I think the challenge always is trying to find that balance between health and performance. At the end of the day, you know, that racehorse has a job to do, so we've got to try and manage them as best we can, whilst allowing them to actually do the job that they're there to do. And that's I suppose where the art of a trainer and all of his support team, or his or her support team around them, are there to try and find that balance. But okay, we'll probably come to some more sort of feeding managements when we get to the next step of trying to rehabilitate, because I think we want to spend a bit of time talking about the sort of quality protein and building that muscle tone and top line, and we can cover off some of the digestive health at that point as well.
Okay.
Over to you, Emily.
So, there we go. So I'm just going to give you a little example. This is one of my friend's horses, actually. She took him on fairly recently. And just to sort of give you an example. So she wanted to have him scoped when he came straight out of training, and he had been a little bit out of work in training, but you can see he's coming out of training not looking like the finest specimen. And we scoped him coming out of training, and you can see he had absolutely horrible squamous ulcers. So he's got grade 4 squamous ulcers, and that real splash thing where he's been having sort of exercise-driven acid splashing. And actually, like I said, the good thing about a lot of these horses, if you can change other things too, is that they often do respond quite well to treatment. Certainly not all of them. I'm not trying to pretend that every horse responds without any problems, but a lot of these horses with a course of omeprazole, he rescoped completely clear. You know, it's amazing that can happen in such a short period of time. And with him, we just tapered his medication for 7 days and then discontinued. And obviously, we made some dietary changes anyway, which we'll come back to. And I'm going to come back to Bob again in a minute. So. So the other thing, then we talk about the glandular part, and the slightly tricky part about this is that when we think about the squamous ulcers, they're quite predictable in general. You know, you can generally have a reasonable idea about which horses are likely to have it if they have the risk factors. The problem with the glandular ulcers is they're a little bit less predictable, and the factors involved are a little bit harder to sort of put your finger on. So this part of the stomach obviously should live in acid. You know, it's where acid is produced. So it's not that the stomach is excessively rated to acid. It's all these other things are, you know, these are the things that protect the stomach here. And so when we're having problems with this local coating, that's when we get ulcers. So the risk factors that we think about for the glandular disease are quite different. So it's not necessarily fast exercise like we see for squamous ulcers, but it's frequent exercise. So horses that are working every day, even if they're not going fast, it's just that sort of repeated experience of working every day. There's definitely an element of stress. Chronic pain is definitely a big thing. So horses that have some uncontrolled musculoskeletal pain, that's definitely a risk factor. And there are also things suggesting that things like new trainers or different trainers or individual things can have an effect on this. And when we think about those horses coming out of training, which are changing life dramatically, obviously a lot of these things are important. Diet definitely is important, but it's probably less predictable than when we think about the squamous ulcers. So this is a horse that's got horrible glandular ulcers, and you can see, you know, you've lost that nice healthy lining to the stomach. We've got some areas of hemorrhage, some areas of sort of fibrin. And again, we can grade these ulcers. There's different scoring systems. You know, you can use descriptive ones, but generally it's easier to think about it in numbers. And so again, we would talk about, you know, 1 being normal up to 5. So when we're thinking about treating these, I think probably the most important thing is that you need to think about the whole horse. So you really have, you need to look at the whole package. Is there lameness that hasn't been detected? Is this horse still finding its environment really stressful? Is the diet right? Is the horse working too much? You really need to look at that whole package of things. And I know that Lou will obviously come on to a lot of these things. And then there are medications that we can use, and certainly we will use them. What's really important, and why the distinction is also important, is that the medications we use for this are different to what we use for the squamous ulcers. And if you just treat every horse with glandular disease with a full course of omeprazole, it's really expensive for a start, but also it doesn't work. So it's just important to know, certainly if you're in this situation, your vet will advise you, but there's different options. You can either use injections or you can do different oral medications, but just using oral omeprazole on its own won't be effective. So just to come back to my friend Bob, so he sort of come back to what I said at the beginning, he'd been home for sort of 4 months and he'd been doing really well, everything seemed to be progressing quite well. And then suddenly just having a real change in behavior, really volatile, having been starting to go quite nicely, becoming really volatile under saddle, really anxious. And so we rescoped him as part of an overall view of how he was progressing, and found that actually having had no ulcers, 4 months after we scoped him previously, he's then developing quite significant glandular ulcers. And so I think that's quite sort of characteristic to me, that these horses at this point are more like, they certainly can still have squamous ulcers, but this is where this is more likely to be a problem. And so we treated him with some of the other medications we talked about and dietary management, but also really importantly, he then had some musculoskeletal problems that needed addressing. He was having a real problem with his back and kissing spines. And for us to be able to deal with the ulcers, we also had to deal with his musculoskeletal disease. So I think that's really important. So just to summarise a bit from ulcers, ulcers are really common in horses in training, coming out of training. The squamous ones generally are a bit more predictable, and they generally respond reasonably quickly to medication and dietary management. The glandular ulcers are more common in horses in different disciplines, and the risk factors are a bit more diverse. And when you're thinking about treating them, they often take a bit longer to treat, can be a bit more challenging to treat. And for all these things, really, to treat them successfully, you need to identify all the risk factors. It's not just giving medication.
Can I interject with some questions from the audience, Emily, because they're very specific to ulcers, and I think follow on really nicely from what you've just been talking about. So one question, which I think is a really good question, it's probably impossible to answer, but actually it is a good question for discussion and debate, is how long would it take for ulcers to heal? And then I would add to that, as the person in the audience has asked, just by changing diet. So should we start with how long would you typically expect it to take for ulcers to heal? And I'm guessing there's not many scenarios where you wouldn't use some form of medication.
Yeah, and I think what's hard to answer about that is that the horses that we don't treat, we don't follow very closely, do we? So we don't necessarily have that information. And it so depends on the individual horse, because in the perfect world, I think if you had a horse where you went from a horse that was having lots of fast work, lots of concentrate feed, had really, squamous ulcers for all those reasons, and then you could move that horse into a situation where it was having a super relaxed life, living at full grass pasture, and it was really relaxed, having that sudden change in management, that actually they might heal in 6 or 8 weeks, something like that. Certainly not as quickly as a medication. A couple of months you would hope to see an improvement. But the challenge being is that it's very rare that you can do all that in one go, isn't it? That you can magically transform the horse. So I would say a couple, 2-3 months, you probably are, if you're going to get natural healing, that would be reasonable. But if you've got lots of risk factors still going on, it probably either doesn't happen or takes longer to happen.
Yeah, and I think from the nutrition perspective there, we would, even horses at pasture, and I think there've been a number of studies now done with sort of feral horses and ponies from places like Iceland, where just being out at pasture and having free roaming access and relatively little interaction with humans does not mean to say that they won't have ulcers. And I suppose the degree to which it's actually causing a problem is one thing. I suppose in the discussion amongst nutritionists these days is that ulcers are going to be quite common, and are they actually presenting an issue to these sort of cases where they've been out at pasture and just come in and you find that they happen to have an ulcer? Well, was it clinically significant? Probably not. But equally then also in terms of when you're trying to manage them and and trying to stop the recurrence. To your point, if you don't eliminate all of those other risk factors, whatever we do from a dietary perspective is probably not going to make any difference, or certainly it might help, but it's not going to necessarily resolve them. So there are so many things to think about when it's gastric ulcers that we're trying to manage. Another good question, I think, is when the horse is in training, can horses race whilst being treated for ulcers? So one question, I guess, is, are the drugs actually allowed for competition, or do they also need a break? I think they're slightly different.
So you can race
really,
on,
but do you want to?
It's one of those questions where you know the answer. Yes, you can race on Gastrogard. That's true, isn't it, Lou? Now I'm really questioning my own thing.
You can now. You never used to be able
Never
to.
said, but yeah.
They've
Yeah,
only just
exactly.
changed it. So you never used to be able to race on omeprazole. It used to be banned, but now they allow it in because it was kind of, why are we not allowing these horses to have good gut health? Like, why are we racing them with it? So it came into a welfare kind of standing. But it's also really important to note that if you then compete your former racehorse under like ROR rule, like ROR competitions, it's also run under BHA rules. So it's not, it's where it gets confusing. So if you like compete BD, BS, eventing, obviously you're running under FEI rules. If you compete in an ROR class at any level, you are competing under BHA rules. So things like Regulate are not allowed. So it's just being mindful of what class you're doing as to where you're allowed to play with what things.
I think that was on the back of some work that, was it Madeline Campbell and Ben Sykes did, I think, in terms of use of omeprazole. So it's an interesting one. Do you want to comment on the break side of things, though, Emily? I guess having, certainly for glandular disease, because the recommendation is to have a couple of days off racing at least to try and reduce them. But in terms of, would you typically advocate, if you're medicating, a rest period, a proper rest period, and then coming back to work at a later date to try and aid recovery?
Yeah, I think, well, I guess it depends what you're trying, what position you're in, doesn't it? Yeah, I guess in an ideal world, you would always rest these horses, wouldn't you? Because you're going to maximise the chance of healing. But actually, in the world where often horses are trying to do a job, you might not be able to do that, might you? So I think in that situation, then yes, certainly for glandular disease, we know that horses having at least a couple of rest days a week is helpful. So I guess just trying to modify what you do is helpful. But some of these horses, you can't, you can't stop their work, can you, completely, because otherwise there's no purpose to what they do.
Yeah. I don't know if this is an interesting bit of anecdotal sort of feedback, but a stud manager who I know, who used to be based in Australia, I think his impression is that ulcers wasn't such a significant issue over there, but their sort of approach to racing was to really have like an intensive training period, do a big race, because there are fewer courses and obviously it's much more sort of spread out. So going to lots of frequent races is not how they approach things with their horses. And then they tend to have a complete period of rest. And he thought that was actually quite a sort of efficient and effective way of approaching training horses if you had a persistent sort of ulcer problem, that you build them up, you do an intense period of training, race, and then you give them a proper break. But again, it's the feasibility and very different structures of racing around the world.
And there are definitely
anecdotal.
There's some horses too where like if you have a yard of horses that are all having exactly the same management, so you have 30 horses all having exact same diet, exact same management, some of them, their personalities are just really different, and so some of those horses will always have ulcers compared to their friends having exactly the same thing. So that's something that you also can't mitigate for, isn't it? Some of that's an individual effect.
Yeah, and in fact we were just writing some editorial along those lines. It's very much the individual, isn't it? Trying to find what works, and when we bring them into perhaps the sort of later career as a riding horse, you are able to treat them as individuals a bit more easily. But again, they've got to sort of fit in with what you can do in terms of time and management and resources, but trying to work out whether the horse wants to be out, wants to be stable. We always think turning out is a good thing, but actually if the horse is hating it out there and stressed or bullied or whatever, that isn't always the best place for that particular individual. But trying to work out what's right for each one is half half the battle, it feels. There was another question here I just wanted to ask. Where's it gone? Where did it come up? Yes, it's probably is actually one maybe for you as well, Liz. I think, Emily, you mentioned at the start the horses tend to start off quite well once out of racing and being retrained, and then 2 to 3 months when their musculoskeletal systems are probably changing, issues arise. What's your best sort of advice at those points? Is it to give a sort of break, or is it changing the exercise plan, routine, all those kind of things? Perhaps we could get both of your perspectives on that one.
I'll start exactly quick, and I imagine I'll have less to say on this than you. I guess from my perspective and the horses I see is probably just taking stock and making sure that there's not an issue that you haven't identified, because actually often it seems to be that point where, you know, if there are musculoskeletal problems, you know, some pain or something somewhere, that actually that is the time where it's really becoming more apparent. So I guess just at least having the reassurance that there's not something underlying before you then contemplate changes in how you're working, etc., etc. And I'm sure Lou will have a lot more to say on that than me.
I mean, like, how long's a piece of string? So I think with horses in that kind of stage at 2 to 3 months, you are increasing fitness, like potentially you're developing posture or trying to, so you're seeing more stumbling blocks. You as a person are then getting potentially frustrated that you feel like you're not getting somewhere quick enough. But I think also it's really difficult because you're in a really difficult place of, is the horse starting to feel fitter in a different way? So they're not cantering, galloping every day, so they're starting to feel better and stronger, but they haven't got, like, they don't understand the outlet for their energy. Does that make sense? Especially when they're younger and they're teenagers, they don't understand that they're not going cantering, so they're like, well, I'm getting fitter, this is the process, you know, we do a bit of walking, we do a bit of trotting, and then we get going. You've also then got seasonal changes, so spring and autumn, depending on what your horses ran. If they're a national hunt horse, in about 3 weeks when the weather turns, they'll get a little bit more bouncy than average, or kind of just off. That's because they'll be like, racing time, kids. So you get that kind of mental place of, if they've been in the system for a few years, they kind of learn what happens with the seasonal changes. And also with that, they're starting to feel really well in those seasonal changes for the first time in their life, because they're not cantering, they're not galloping. But I think especially in the young ones, I think breaks are actually really, really good, but managing those breaks. So not, if your horse isn't in pain and isn't in discomfort, it's like, is this behavioral? And it's knowing that line of, where do you sit? So that's your home teams, your physios, your farriers, your saddlers. And if they're gaining weight, they always say on a weigh tape, if your horse has gained more than 2 kilos on a weigh tape, your saddle's probably not going to fit. And if your saddle doesn't fit, then it's going to present as back pain. And then sometimes we're quite quick to grab the x-ray machine. And it's like a really hard line of, where do you start with what? And also they're changing and they're growing, especially, I think the lady said, said that the horse is 4. So the amount they'll start growing, because they're not cantering every day, will also come into that. So they might be going through a growth spurt. It's like a complete minefield, but it's so many things to factor in. It's like, you can send yourself absolutely mental with what's going on. You really can, because like when Emily was saying, you know, girthing up, putting rugs on, it's a sign of ulcers. It is, but it's also a sign of them having rugs thrown on every single day since they were a certain age, and they're like, oh, get off. And it's like, it's not because they've got ulcers, they just get a bit and they're used to the girth being racked up a bit quickly, so they kind of assume it's going to hurt or pinch, or they have had ulcers, or they have that memory of pain. So it's like, you will send yourself around the houses of growing grey hair because you just feel like you can't do right from wrong. But it's trying to work out what each horse is trying to tell you, whilst you're also learning who they are as a person, and they're trying to work out who they are and who their people are. And then you're on a DIY yard and 50 horses go in all different directions at all different times, and they can't work out what the routine is. So there's a whole host of factors, and that's where it becomes quite difficult. And then that causes stress, which then can cause ulcers. Like, sorry, it's just like, it's the workings of having these horses. It's so difficult to know when is something is pain, when something is discomfort, and when something is behavioral. And it's so difficult.
Do you think, is there any merit in, it depends on everyone's circumstances, but giving them a kind of opportunity to go out in the paddock or wherever for a period of time to almost kind of reset and refresh? Or do you think that's I mean, it's not always possible, but is it a bit of a, because as soon as you bring them into the environment, you're going to keep them in, you're still going through that process?
I think turning away, as in turning away, throwing them to the field and not handling them every day, for some of them, they don't understand it. And I've got some that like literally will fence walk because they're not used to being able to put their heads down and switch off. And they're like, within 30 minutes, they're like, well, what do I do now? Like, and they start looking and they start counting heads. And I think it's almost slightly unfair on them to be like, no, I've been told to turn you out and not look at you for 6 weeks. See you later. I think that can be quite difficult. For some horses, it works. For some horses, it doesn't. And I think when you've got a horse that's distressed and fence walking or isn't eating, and there's a difference between them dropping off, losing their racing fit muscle to drop, because they will look a bit like crap because everything will just fall away. And then you'll be like, oh my God, they look worse before they get better, but that's because they've got to lose that racing fit muscle. But for some horses, turning them away and not looking at them is fine. But I think, again, if you're not handling them every day, they're used to being handled. Some of them, then their manners get worse because they almost go a bit feral because they're like, bye, freedom, see you, like, off I go. So sometimes, again, getting them back into that routine, most of them are fine because they're so used to it and they're so used to like breaks, especially the National Hunt lot. They're used to breaks being turned away for 2-3 months and then coming in and starting doing work. But again, the problem is that vast change between bringing them in and then going into work can sometimes kick off that racing mentality again. So actually, I think bringing them in every day and giving them a routine, because they thrive on a routine. Like, you don't have to ride them or do anything with them, but having them in, having a feed, having their feet picked up, going back out to the field, that does settle them a lot more because they know what's going on rather than going from feral to work, because that's quite racing routine based, I think, personally. But it varies on the horse and the environment.
Yeah. Okay. Thank you for that. Emily, did you want to, are we at the stage in your slides of looking at vetting, or are we?
Yeah, so kick off whatever else you want. That was all.
Well, I think that probably leads us in nicely then to that process of someone exploring whether they want to rehome a racehorse and retrain a racehorse. And Lou, do you find that people go direct to the trainer? And if so, then we'll bring in Emily in terms of what they should be looking for from a vetting process. But is that normally how it's working?
I think there's a couple of routes. I think, again, it depends on the person's circumstance, and the person has to inwardly look at themselves and their own ability. I do think there's a big romantic idea of I'll phone up a trainer because the trainers have nothing else to do than answer their phones to everyone to want to rehome. And getting hard, and then they get mad they can't get hold of a trainer, and everyone's desperate to get like the famous ones. I think getting them from a trainer is great because you have a lot of insight into what the horse is like when it's fully race fit, but it can also give you a jaded version because it can be like, oh, well, they're fine when they're fully fit, and apparently they're like Muffin the Mule, but actually when they then have a bit of downtime, they don't know them post racing, as it were. But the trainers are great, but then the trial facilities, obviously you've just got whatever they've got, so it's a bit of a lucky dip because you can't necessarily trial them. And speaking from experience, I've had trainers literally send me photos of horses' heads over a stable door, and it's normally a grey horse, and they're like, do you like this? What do you think? I'm like, oh, cool, I'll be there with the lorry tomorrow. I haven't even seen it walk, but I'll go and merrily pick it up because it's a grey, pretty racehorse. Like, I'm a sucker. But I think there's a mixture of, some will go to trainers, but I think also trainers are now slightly outsourcing as well to retrainers, because then again, it helps them, one, get the stables free, but two, it's that kind of responsible rehoming. It's not saying trainers aren't responsible, because they do care, but them being able to have that, like, if it doesn't work out, where does the horse go? Like, it's just the next stage a little bit, but it is changing, but it's just tricky. Some trainers rehome within house, so like the Skeletons rehome within house. Amy Murphy, when she was here in the UK, used to rehome within house. Some do, but then some don't have that kind of availability of yard staff and time to be able to do that as well. It depends how the trainers sit. Lucinda Russell retrains from in-house. Call it, just different trainers do different things.
Yeah. I think no, that's great. And from memory, most of those would have had facilities to prepare a horse for retraining as well. It's probably, like you were saying earlier, a lot tougher if you're in the middle of Newmarket with limited space and turnout.
And I think it's people's expectations. You can't expect to go to a trainer and be able to ride around an arena. Like, it just doesn't work like that. Some people have it, some people don't. But I think, again, that's where it's a lucky dip, a little bit. A bit of lucky.
Yeah. Okay, so Emily, from your perspective, I know vetting is not what you do, but you've kindly done a bit on this in terms of just helping people to think about what they should be asking their vet. Or, I mean, I suppose that's a good question to start from. Would you typically suggest that people use their own vet, or is it better to use a vet in proximity, close proximity to the trainer? Does it matter?
No, that really matters. Like, it obviously helps to use your own vet, isn't it, that you've got a good relationship with, but actually sometimes I guess you also might be better to use a vet who has more racing experience. I don't know. I think just using a vet that you're comfortable with is probably the right thing. And I think from the point of view of disclosure, you know, actually that shouldn't really be a big issue either way. So I don't think that probably really matters.
Okay, so what would your recommendations be when it comes to undertaking a vetting?
So I just got
purchasing one.
Yeah, I've got a few slides I'll just share with you, which I promise they're brief. There's not many of these. So yeah, so Katie asked me to ask about this, to vet or not to vet, and I guess it is really variable. And actually, when I like Katie said, I do mostly medicine, so this isn't necessarily what I do all day every day, and I canvass a lot of opinions. And it was amazing to me, even in my own practice, and the only you know horse owners in our practice, what the diverse opinion on this was. But I guess the thing that you really have to bear in mind is that most of these thoroughbreds have had quite a demanding work career while they were still quite immature. So actually, you know, if you're looking at a subset of horses, there is going to be a relatively high rate of training related injuries. And lots of horses have had joint medications, different treatments. And so you do definitely want to be careful, because some of the problems are definitely like to resolve with rest and time and the correct rehab, whereas others are like to be performance limiting. And so, you know, we all know, don't we, that taking on these horses is such a commitment. It's not necessarily, you know, we're talking about the initial financial commitment. It's not necessarily the cost of the horse, is it? But the cost in terms of, you know, the care of the horse after, the emotional commitment to these things. So I think you want to know that you are getting a horse that's likely to be sound for what you want it to do. So I think, you know, my advice would always be to at least have some sort of veterinary check. And if not a veterinary check, having someone really experienced look at the horse. You know, someone like Lou would have a very good handle on all these things. And I think if you can get a history, that would be really helpful. So knowing what problems the horse has had is going to give you a big chance of knowing whether or not they're likely to have ongoing problems. So if you think about looking at the horse, what are the most likely sites of problems from a horse coming out of racing? And probably the areas that we're most going to worry about: fetlocks definitely, knees definitely, and then hock, stifles, back definitely, pelvis definitely. And I didn't put feet on here because I'm saving that all for Phil, but feet obviously is a massive part of this too. So these are sorts of areas that you're thinking about, and when you're looking at these horses, you want to be making sure that you're really assessing. And neck actually too, especially for horses coming out of national hunt racing. So these are the sorts of things you're going to want to look for. So things like tendon injuries, you know, with all that fast work, there's a reasonably high incidence of tendon injuries. So any sort of bowing of the tendon or thickening of that area, you definitely want to have a bit of, you know, caution about. This on the right is an ultrasound image of a horse with a massive hole in its superficial tendon. You know, that is very likely to be a horse that is not going to be doing a really high performance career afterwards. Fetlock problems, again, joint problems are really common. This fetlock on the left, nobody's going to miss. That's a massive fetlock. But you certainly can have more subtle things. So this horse in the middle's got a small crack, a small stress fracture. And the horse on the right's obviously had a bigger fracture that's been repaired. And you've got to bear in mind that if these horses have been out of training for a bit, when you see them, the joints can be quite quiet. You know, you might not see as much effusion as if the horse is still in a lot of work. And that's obviously important. You know, if the more, you know, some of these problems, that horse in the middle, that may well have a perfectly long career actually and not have any lameness. But the more significant the injury, the more cartilage damage, the more likely this is a horse that will have arthritis for the long term. So it's something you definitely want to think about. Knees are another big thing. You know, knee injuries are quite common. This horse in the middle's got a tiny chip right in the middle there. And this horse on the right's obviously got a much bigger fracture. They're probably going to be okay in the short term, but the bigger problems are likely to have arthritis, which again is likely to be a performance problem. And this is a horse that's got quite bad pastern arthritis, so all that sort of fluffy bone you can see on the outside of this horse's pastern. And this was a horse that was actually still racing, but again, this isn't a horse that you're going to be able to get around Badminton probably if you take it out of training. Kissing spines, and I'll let Lou talk more about this, but just say that is definitely another thing that we worry about. And again, neck problems. This is a horse actually that was still in full work, and they had commented that the horse actually had a bit of a stiff neck. A horse that it then transpired had a rotational fall at some point. So certainly, especially jump horses, which have had falls and different things, they can actually have quite bad arthritis. And again, these things are the sort of problem which could be performance limiting. Just the other really big thing to think about is that breathing problems are quite common in racehorses. So we have this condition called recurrent laryngeal neuropathy, which is where the larynx, so the cartilage which open the windpipe, the nerve on the left side is longer, doesn't always work as well. And so you will see, this is a picture of a scope picture of a racehorse at full work. And as that horse is really breathing in hard, because that nerve's not working as well, it's sucking in the cartilage over its airway, and that obviously causes a problem. And so I think if you can you hear that noise? Is the sound coming over? Yeah.
I'm not sure I'm getting it actually.
No.
Is anyone, Louis, can you hear it?
I've just muted it, so that's when you can help.
I can't hear it, but I just think Emily should make the noise herself.
No, you can't hear it. So what this horse is doing that you can't hear, let me stop it, is that they make a lot of whistling noise, and when the horse are breathing in, that they'll make a lot of inspiratory noise. So that's definitely something to look out for. So I guess just to conclude, if you had all the money in the world and it wasn't an issue, actually I would definitely recommend you have these horses vetted. There's two different types of vetting. You can have a 5-stage vetting or a 2-stage vetting. The 5-stage is much more comprehensive. The 2-stage is much more limited. Just show this is the sort of summary of what you get. So in the 2-stage, you're just getting a basic check of health and soundness. So you're getting an exam at rest and trotting up. Whereas with the 5-stage, you're going to have much more, you get all the ridden part of it, if that's feasible, or lunging, which is probably more likely for these horses. But you probably want to think about doing the least the 2-stage, and especially if you're thinking about having these horses insured, which again, even if you're not investing a huge amount in the purchase of these horses, actually having the reassurance that if you do find at 2-3 months that you're running into problems and they have got, actually maybe they have got problems that you hadn't identified, having that reassurance that you're going to be able to finance treating them is really helpful. So at least having a 2-stage vetting, I think, is sensible. You're not going to pick up everything, definitely, but at least having a sensible look at the horse with somebody who's experienced in the likely problems that you might come across. And you might need some degree of, some cases, if you've got something particularly worried about, maybe the trainer will have these, they'll share with you or not. And certainly if there's good disclosure, they might do. But sometimes you might need a few extra things to actually help you assess whether or not this horse is likely to do whatever it is you're hoping it will do. So I guess that was my summary on it, that actually definitely it's recommended, I would think, to vet these horses, especially and probably most importantly, if your end goal is high level performance. If you are going to be satisfied that you're just going to ride up and down the lane, it probably doesn't matter nearly as much, and actually the horse's personality and match to you is more important. But if you are looking to have this horse that you want to turn into a different type of elite athlete, it's really disappointing to find that you've taken on a horse that had fetlock disease that you haven't picked up. It doesn't become apparent until you put a lot of effort into it. And just the other, if you're having these horses better, just also worth bearing in mind what the horse's current level of work is and period of rest, because if the horse has been rested for a little bit, some of the things might not be as apparent. So it's definitely worth also just considering that.
Brilliant, thank you. I just wanted to ask actually on the kissing spines, sort of, is it that we're just diagnosing it more now, or is it something that's an increasing problem? And do we know why, if the latter is the case? Because it certainly seems to be something that's much more talked about and much more commonly sort of a reason why people are having their horses operated on or undergoing some form of surgery or something. But, and being the age I am, it seems to have increased over the last 20, 30 years. But is it just that we're diagnosing it more, or is it actually an increasing problem?
I don't know that. I don't know that it's necessarily increasing problem. I think the reason we see it in horses, a horse in training that can have quite bad kissing spines, it doesn't become apparent till it comes out of training because of the way they're working. That if you're running really fast in a straight line with a really light person not sitting on your back, it doesn't actually cause you a problem. And then as soon as you are out of training and someone's asking you to come into a contact and you're heavy. I mean, Lou, do you want to comment further on that?
I think you've hit the nail on the head. I think also we're quite quick to go looking for problems, because also it's having the right people around you that take the images and go, okay, your horse does have kissing spine, but how is it? Are they struggling in their work? Like, are they actually able to use their back? And I think sometimes your physios will tell you a lot more before you have to hit an X-ray machine, personally, because I think it's a bit like with ulcers. Everyone's quick to X-ray and scope. And it's like, actually, can we make small little adjustments or small changes before we hit that? Because the likelihood is with most thoroughbreds, they probably do have some sort of closed processes. How much that then affects them varies on a horse-to-horse basis, and what they're working out, the question that's being asked. And I think sometimes knowledge is good, but I think knowledge can also be a hindrance. Like, and it might sound a bit mean, but actually I think unless your horse is physically struggling and physically in pain, if you go looking, your back might have a few close processes, but if you make the back comfortable, something else can fall apart. It's like pulling that one card out of the deck and everything just goes bang. So it's like, is the back the primary cause? Because I've had loads of horses that have come in and they said, oh, they've got ulcers and we treated the ulcers, where actually they've got a really sore back. And then this pain from the back has created the ulcers. Does that make sense? So you're kind of like, well, actually the ulcers weren't the problem to start with. And it can work in all directions.
Yeah, and I'm a massive believer in that. I think when we're, people are so desperate to scope horses, and it is a big part of what I do. So I'm not trying to do myself out of a job, but I think actually we're really doing a disservice if we're just scoping the horse without looking at the rest of it, because those musculoskeletal things are so often, I think, one of the driving factors. And you just, you can give all the drugs in the world, can't you? It costs thousands of pounds and it doesn't fix the problem.
So, like, we've got one horse. I'm gonna wake Phil up. Phil, wake up. But it's kind of like, we had one horse, Sunny, that Phil was like, there's something wrong with his front feet, because Phil couldn't keep any front shoes on him. And actually it was his back. I don't know whether Phil wants to kind of join in, because like Phil will admit he hated this horse because he couldn't keep shoes on it. Like, and there's nothing worse than a barrier than not being able to keep shoes on a horse at all.
Yeah, I really struggled to keep shoes on it. It was Lou that turned around and said to me, "Oh, I think it could be its back," and I was a bit, really, so not just got really bad feet. And I think it's one of those, everybody was blaming the feet, and then we had the back. Well, the lady had the back X-rayed, and it was unbelievable how fast things changed and came around, and we started to get the feet back together, and the soundness of the horse, everything changed, and it was all through the back. And I think that's the thing. I think in any condition in the horse, you've got to look at the whole picture. I think we just rush straight to the symptoms rather than finding the cause.
So was that affecting his way of going then, to the point where he just kept pulling shoes off, or?
Yeah, so I think it was affecting his front limbs, wasn't it? So he's coming up quite short. So therefore, because obviously, especially with the Thoroughbred, because they're built so they go really fast in a straight line, they're quite bum high. So the hind legs move sort of have more extravagant movement, and then they just overreach because the front feet aren't moving as fast to keep up.
Okay.
But I did find it interesting when Emily was like doing the diagram of like, these are the common areas. I think all that was left was their eyeballs. Like, we've got this. I was like, okay, we've got eyeballs left, maybe an ear. I was like, so that's how complex it can seem a lot, because you just think, goodness, what isn't affected? And it's not a negative slant on it. It's just, again, it's more considerations, because I don't know, Emily, if you see it the same, like with Phil. Phil, you've got it when you pick up back legs, don't you, with hock pain, that they then can't hold their back leg up, which then, I don't know if Emily, then you see it somewhere else. Do you know what I mean? It's like...
Yeah, I think nailing on. I see with the nailing on with hock pain, they normally flinch. I can always tell if a horse needs them. It's hock's doing. If I'm nailing on, it's flinching. Sorry about my dog.
Luke, can I ask you a question? What, because I'd be really interested on your view on this, because obviously I'm a vet. I say that all horses should get vetted, and I don't say that, I think having, especially if you're not experienced, having some of the experience is really important. Do you ever vet any of the horses you're taking on for yourself? Like, how do you view that?
No.
Yeah, no, but that's fair enough, because you're experienced. It's an interesting thing, isn't it? I think.
So I literally grabbed my phone and I asked for the horse to be trotted up away from me, so rear and front view, and then from the side. Then my closest friends, who probably hate me, Phil is one of them, my vet, all get the same video sent to them with the, I'm stood in the middle of the yard, please can you watch this right now, because I've got about 30 seconds to make a choice. And it's really hard, because when they're race fit, they're going to be stiff. Like, and it's really difficult to be like, is this horse sound or not? And do I want to trot them on a 10-meter hard circle? Probably not, because they're going to fall over and they're probably going to look a bit lame. And it's really hard to know what's racing stiff versus lame. And then I have a few horses where like they're like, well, it needs 9 months off because it's done a tendon. So I can't vet that because that's going to be lame regardless. And I always think I'm fortunate that I've got good relationships with trainers and people of like, I'll be like, is this going to muller me? Has this taken off with someone up Warren Hill and they've not been able to stop and they've headed on down into town? Yes or no? Tell me, because someone's going to tell me. But I think it is a risk, but yeah, I don't vet because I think it could be quite overwhelming when you get a vet report, because you guys have a responsibility to report your findings. And when you get 5 pages of A4 in vet jargon, it's like, what is it? What is this? And also the vet's in a difficult position because they can't really assess the horse for purpose in a racing yard. Like, is this going to be a good hack? We don't know because we're seeing it race fit. Do you know, like we're trying to see the horse we've got in front of us. But I do think now with insurance, you need that coverage. But then I think if you put a racehorse through a 5-stage vetting with someone that hasn't worked with racehorses previously, are they going to fail it? More than likely. So then how much money do you spend on vettings? It's so difficult because 5-stage vettings aren't cheap. And then if someone goes, well, I want to take an x-ray of its fetlocks, its hocks and its back whilst you're here, you're probably going to find something because you're going looking for it. And what are you then going to do with that knowledge? You're then going to message all your friends. I've seen this 4-year-old ex-racehorse. I can't ride it. And it's got all this. Do you know, like, it's really hard because then how do you give these horses a chance? It's such a, it's difficult. It's really, really difficult. But yeah, I don't vet. I'm like, you're lame or you're not. And if you're lame, you get a tendon. I've got to see if you come sound after 9 months to a year in the field. And that's my choice.
From a personal note as well, Lou's game of guess which foot is lame on isn't fun at all.
Phil's just outed that in front of everyone. Lou, do you, in terms of, go on.
When I send him a video of the horses actually sound, and I'm like, does this look right? And you can see Phil going, is this a trick question? And you can hear it, like, he doesn't reply for about 10 minutes because he's like trying to work out which foot it's lame on. And I'm like, it's sound. He's like, yes, it is. Thanks.
Well, I think a lot of it does come down to experience, doesn't it? I mean, you've obviously had a lot through all sorts of horses, Lou, not just thoroughbreds out of training, but it is a level of reassurance if you aren't experienced and you don't know what to look out for. So, yeah. Do you ever go and look at horses for other people? Would you do that and help people in that sort of way?
Yeah, I'm more hyper vigilant when it's for not myself because the level of responsibility is so much higher. If it's not my own neck that might be heading to A&E, I'm like, it's my own choice. But yeah, it's making sure I match the right people with the right horse and making sure that if the horse has got certain things that we know about, that the person has the right support team around them, and making sure that if they don't and they aren't confident or their abilities don't suit the horse I've got in front of me, then they've been brave enough to walk away, because we all fall in love with horses like we do with dogs and cats, and we go, cuddle, I'll make it work. But I do try for other people, and I go and see horses, and I see enough horses through teaching and going to various places and seeing them in different scenarios. But yeah, it's just knowing where the line is, and it's just difficult. But I do always, I think as long as you've got a sensible vet, a vet that understands the horse they're going to vet, you're fine, because then people can have an open conversation. I think it's when you've got either you don't know the vet, or you're putting your trust in someone, or someone that doesn't understand the horse they've got in front of them, that's when it can get a bit tricky. But if you've got people that see these horses day in and day out, then they're balanced and fair in their judgment, and therefore it's peace of mind.
And I guess if you're not experienced, then coming to someone like yourself or a retrainer with a good reputation, they're going to want to pair the right horse and have gone through all that sort of risk as far as you can for you.
We want to see it work. We want to see it work. We don't want to then have to have the horse in however many months later because it hasn't worked, and we have to find the horse a new home. We want horses to stay in homes for however long. People's circumstances change, but we want to see horses thriving, and we want to see partnerships thriving. We don't want it to go wrong. Sometimes it does go wrong, and sometimes it doesn't work out, but we don't want horses bouncing around, because especially when it's December and it's -12 and everything's frozen, we don't want to have to turn our tack room into another stable to try and make it work. We really don't. We're very well practiced at it, but we don't want to do it. But it's kind of, we want things to work. And so I think safety and enjoyment is paramount, regardless of the horse or the breed, but especially with these horses, is that you love them and you enjoy riding them, or you enjoy their company and you feel safe on them. Like, that is the main thing. And as soon as those two things aren't there, it's not the right horse. But yeah, we want it to work. We want partnerships to thrive. We really do.
I think that's probably quite a neat segue into if you've got some slides or case studies that you wanted to share with Phil's, I know, going to contribute on the commenting on the hooves and things.
Yeah, so it's going to contribute. So I've got a mixture of slides. Katie, where would you like me to start? Do you want me to talk about forces or training, or where would you feel most comfortable with, or comfort? I've got a full range.
I think if you've got someone there along the lines of retraining, because I think if we've progressed out of the training yard, and then where here we go, some top line posture, where you would start in trying to get them stronger and better able to cope.
Yeah, of course. I think, just very quickly, for anyone that it's really important to know what we're starting with, which is a horse that's built to race, which is you're on a retraining racehorses webinar, but you're built on a horse that's built croup high, so their body has been built to make them go fast. So where you sit on their back is literally where they split. So when you've got a horse in the galloping phase, if you ever galloped a racehorse, there's this really cool moment where the horse drops by about a foot and their stride length becomes longer, and it feels like they literally sink down. So for their body to be able to do that, they are built croup high, they are built on the shoulder, and they are built with their forelimbs slightly positioned behind the vertical. So you've got these long hind limbs, which are their accelerator, but the forelimbs positioned behind the vertical, which means you've got this downward force. It basically, if you think about what it's like to push a wheelbarrow along, that is what it's like for the forces that are acting on your former racehorse. Everything kind of goes up, down, and then the thing that stops them falling over is their neck and their shoulders. And that's why they run around with their neck in the air, because if they didn't run around with their neck in the air, they'd be doing a forward somersault everywhere, and then we'd all be falling off over their heads quite a lot, like a third world pony. But obviously in the retraining world, we're teaching them how to rebalance themselves and how to use their posture in a different way. And that it's not possible, because this horse here, and I should probably put this in slides properly, but I'm gonna be squizzing around. This horse here is the same horse. So you've got your croup high horse. He's now working at advanced medium. He just won the ROR special class, so for advanced medium above, at Aintree Championships. He won £95,000 on the track. He was a flat horse. He is probably one of the most croup high horses I've seen ever. My trainer, when I brought him home, said, "Oh, well done you found an even more croup high horse than your current top horse. What were you thinking?" But it's not that they can't not sit and they can't not carry the rider around them. It's just how you go through that transformation. And the same with this little person here. This horse was ROR Horse of the Year in 2019. He's competed up to Inter 2 level dressage. Again, built downhill, neck upside down. That photo on the right also is not of him day one. That is him 3 years ago. He is 18 now, so that is him when he was 15. And the photo on the left was 2 days later when the sun was out. So it's not like a before and after. That is him stood in his normal state, looking like a shaggy pony. Again, it's not that it's not possible. It's just, how do you do it? So again, this is just a very quick thing of the forces that go on. This is walking around for quad's first PSG. And you can see the amount the forelimb comes back under their body and how little space there is available under their stomach. So whenever you've got a trainer that tells you to put your leg on to get them to connect leg to hand, there is actually no physical space for their hind leg to step through. So it's, how do we do that, and how do we go about it, and how do the forces then load on them to keep their happiness and their comfort? And basically this just shows you where you might get like muscular atrophy. So the bit right behind the wither and the saddle, the neck normally comes down out from the base of their chest. Again, forelimb position slightly behind the vertical. So everything says can't possibly do a second career, but these horses, we all know they're amazing. We all know they're brilliant. We all know they can do a second career. And this is kind of what we start with, a version of a horse that looks a little bit lame, a little bit shuffly, runs around a little bit like Twisty McTwisty through the head and the jaw and the neck, and we question all of our choices. We've gone through comfort. So balance plus comfort equals development of posture and top line. Also, forage analysis is a game changer. I put that in there because I always forget to say that. Katie will like me for it. Make me happy. So, Phil, I'm going to start with you. Top line. That's Greg. That's change of Greg. Right, Phil, we're going to do Sunny. Sorry, we're going to do slides first. Actually, I shouldn't have done the slides. So Phil, this is the horse we're talking about. There you go. That's Sunny. This is the horse you couldn't keep shoes on. Do you want to talk about him?
Yeah, so I think everybody can see from those x-rays, it doesn't look too tasty. So yeah, so Sonny, you can see his neck's up in the air. He was very, he was a funny horse when he first, well, I shot him at a previous yard. And then when he moved to Lewes, where I carried on shoeing him, I was very reluctant. I didn't enjoy shoeing him at all because he wasn't the kindest horse, but also, like we said, he kept pulling shoes. And I was probably near enough at the stage where I was like, it's just the way he is. And then I recommended for the lady to give Lou a call and discuss it with her. And then obviously all this transpired with the kissing spine. And I didn't realise how badly he moved until Lou had sent me the videos. And it wasn't one of the guess which put his lame on videos. It was just these uncomfortable videos. But I think as we sort of first arrived, because of all the shuffling that he was doing and the weight bearing, his heels were quite low, his soles were super thin. So he felt down all the time.
Didn't you say he had ulcers as well, I think, wasn't it? He'd been treated for ulcers.
Yeah.
Wow.
I think so, yeah, but I didn't know if that was secondary to the kissing spine, because he was obviously very uncomfortable all round. Like he was hard to shoe behind. Very hard to, I think, yeah, because I don't think he had shoes on behind before he arrived. And then we got round to putting them on, which was great because he just became a different horse. I actually started to like him.
This was Sunny. So go ahead. Sorry, Katie.
I was just going to say, in terms of timelines, and particularly from your perspective, Phil, if this is the first time you've shod a horse and it's got these issues, doesn't want to sort of, or it's certainly not comfortable when you're shoeing, how long do you sort of give it before you think actually this is more than just a behavioural thing, or are you suspicious from the word go, or do you think there's a period of time over which you're forming an opinion?
Yeah, so I don't believe that any thoroughbred. I don't believe the people that say thoroughbreds are naughty, because out of the 20 horses we have on our yard, only one of them has ever really needed to be held for me to shoe, and that was a warm blood. All the thoroughbreds are completely tied up, all burnt on. You know, we straight out of training, we get them into a routine. We tend to find that I have to move around the yard a lot. So we keep them outside their friends' stables, or we keep them cross-tied, or we tie them up so they can see each other. And we just make sure they're happy, really. And it makes a huge difference. So I think when it comes down to pain, I'm more of a sort of, I don't know how to put it, but sometimes I think, oh, is this pain, or is it just being silly? And then I have to remind myself that there's a 90% chance there's going to be another issue as to why the horse is messing around. It's not just being naughty.
But we had one recently where he was an angel to shoe when he first arrived, and then he arrived shod all round, and he does not do the whole take the shoes off thing. He's always been shod all round, and he was really, really good. And then about 2 years into his retraining, 2.5 years, all of a sudden one day he just became weird to shoe behind. He would not let Phil pick the hind legs up and pull them forward, and he would just jump around. And he's a really mannerly horse, and it kind of escalated, and like we just thought, what's going on? And it turned out that he was actually the hock pain. He needed his hocks medicating, and he had got to the stage where he wasn't struggling under saddle. He was kind of elementary medium level, but he was at that stage where he was beginning to sit behind. And like I said, he wasn't struggling on the saddle, but it actually showed up with his shoeing, didn't it, Phil?
Yeah, and I think we both missed it. We both missed it when it first started. We just thought he was just messing us around because he's got a bit of a character. But yeah, and that's taken a long time. So the time period is really hard to tell. So with him, we've got to the stage now where he'll allow me to nail them back on. He'll allow me to pull them forwards and clench them up as long as my foot stands only sort of up to my ankle. He'll allow me to do it. So it's regaining that trust. And some horses it just takes longer. Some horses you know, when they become comfortable, they trust you quicker. Whereas like with this one, he's just taking a little bit longer to regain that trust, because obviously I was putting him in a painful position, which and we all know if somebody puts you in a painful position, you're not going to forgive them. And I think it's one of those. So time is it's a weird one. I think it's different for every horse, every single horse that we try and treat completely different.
Yeah, and I think it's one of the things, if you're not experienced, that is hardest to know when there's a problem, or when to call a vet, or when to involve others in this sort of situation, because it's almost, you don't know what you don't know, and it's a bit like how long's a piece of string. But I think you commented there, Lou, that something had changed, had been all right, and then it changed. And I always feel that that's a good guide. If you're experiencing something that's not normal, or there's a change in behaviour, that's a good indication that something's up, isn't it? Rather than, you know, or as a marker of perhaps when to ask for someone else or some professional help.
We had it with
if
this.
It's one particular leg, I always think there's got to be another issue. It can't be sometimes if they'll mess you around on both legs, but if it's one particular leg and the horse is normally okay, I always think there's got to be an issue here. That can't just be its behaviour.
But you also had it with him where he was like the right hind, and then Phil would go to drop it and he'd snap out behind with it. Like it was almost like he had to like stretch the leg out, didn't he, Phil? It was like he'd held it for so long. And again, he's a really mannerly horse. So for him to even say boo to a goose somewhere, I was like, what is going on? And I used to just be able to walk away and leave Phil with him. And then it got to the stage where I had to untie him, hold him. Like it was, for him, it was really escalating behavior.
Yeah, we went down to he's cold shot behind as well now, because we tried to eliminate everything. We just went back to basics, and we've worked our way forwards. But it has taken a long time. It's not been easy, but he's starting to trust us again, and that's the main thing.
But we had it with this horse as well, is that he came in for 2 weeks stay, and then I couldn't even this horse was really bad. Like he couldn't go forward. I was really worried about my pivot getting an absolute smacking because he was just sending me everywhere, and he just couldn't actually move. Like as soon as he went to turn, he'd either stop up, jack up, do something. And again, the lady, his owner, is really lovely, but she was like, I didn't know this, but she said whenever he was shod, she had to stay with him. And I was like, what are you on about? Like, and again, the difference with him, like Emily was saying that he's a classic. As soon as this is 24 hours later, is I rode him in a jump saddle. I got up off his back and he could all of a sudden drop his neck and lift his back and actually travel forward. And all I'd done is just change my position of being around him. And that was off his back and letting him work like his first career. And he was very comfortable. And again, he turned out to have basically the whole of his back as a series of kissing spine. But he's known also again for pulling shoes. So his sign is, when he gets sore in his back, he pulls his shoes off. I think he pulled 3 shoes off in 24 hours once. Like, and I knew
it was just relentless. It became relentless. It became to the point where I didn't want to. I was, if she hadn't contacted Lou, I wouldn't have carried on. It was just, there's nothing I could do. I just felt it's one of those demoralising things where you start to blame yourself. And I was completely lost. And then the sad thing is, obviously, once he went home and the training didn't carry on, and all these things started to reoccur again, and that's when we knew there's, again, it's keeping all the things that you're taught. And I think Lou, obviously a big fan of long reining, and we knew straight away she stopped doing it, and everything started to appear again. So he started to get uncomfortable with his hind legs, and then once he started doing that, he started pulling front shoes off, and it was such a shame because he was in such good nick when he went home.
We talk about bad feet, Bob.
Oh, you're saying about bad feet, Bob. So bad feet Bob arrived.
I'm just going to warn Emily now. Emily, there is a shoe on that foot, by the way, just from a veterinary point of view. There is a shoe on that foot there. There is
Emily, there's actually a heart bar on every one of those feet.
Can I just?
That's a 3/4 heart bar, I think, was on that foot. I think that's why it looks like there's no shoe. I think it's a 3/4. So this was 2 weeks post shoeing, I think.
Yeah, 2 weeks. 2 weeks post shoeing. What were you going to ask Katie? Yeah, what were you going to ask Katie? Katie's face, literally like that.
Just because, is there any foot that you wouldn't sort of take on from a farrier's perspective? I'm just imagining what a person might go and see in a horse in training, and or maybe that's just been turned away or something and left for a bit. Is there any confirmation you wouldn't take on from a farrier's perspective?
I think from a professional point of view, as long as I had the backing of a vet, as long as I don't want to be horrible, but as long as somebody else takes the blame if it all goes wrong. I think it's as long as you've got a good home team. As long as you've got a good home team and I feel comfortable, then I will take any challenge on. But obviously it's situations more that I don't like. When you're stuck in a situation that I feel uncomfortable in, I feel as though, if I don't get it right, there's going to be issues. Whereas if I know I don't get it right, but people are still going to go forward and carry on trying, not blame me for an issue, then it's absolutely fine. I will try anything.
So if someone was there wouldn't be any sort of alarm bells that you'd say to someone, don't touch it because of its hoof conformation or anything like that. If they're up for the challenge, then you would be too.
Yeah, oh, definitely. Yeah, as long as people understand it's a journey, it's not just, you can't fix these, even though you're going to see photos of this horse 40 minutes later, but you can't fix these things in one go. It's a journey that everybody has to be prepared for. So I think a vet once said to me, if he wanted a horse to be on box rest for 6 months, he always said 8. And then he could argue down to 6. So he always got what he needed. And I've always feel like, if you tell them it's going to take a couple of months more than you think it will, you'll either look like a hero or you have a couple of months extra to try and play around. So
under promise and over deliver.
Phil told me the other day, though, that Greg probably had reverse rotation in his hind feet. He just kept that one quiet, very, very, very quietly. But
he had no symptoms to it. I think that's the thing, isn't it? He didn't come up lame. There was no point in X-raying when his feet were just super flat, and we knew they were. Let's get to the good feet. The good photos of bad feet.
So which way do you want to do this? Should we do it? So this is what we call this is bad feet Bob. So this basically, I got a phone call from my vets saying this horse is lame, not surprisingly. The farrier is struggling. We've taken images. The horse either has to come to you and Phil has to sort this out, and you guys need to change this horse's management around, or we need to put this horse to sleep because we're struggling quite a lot. And this horse at this stage was on £100 a week hard feed alone to try and make it look better, feel better, and also in theory to try and improve its hoof quality. And these were the x-rays. The one on the right is of that foot there, which is on the floor. Really bad. And then which way do you want to do this, Phil? Do you want me to do photos of feet first or photos of x-rays? What do you want?
Yeah, whichever. I'm easy.
Okay. So this is 45 minutes later of the foot. I'm not going to talk. What did you do? I'm not going to talk for you. What did you do?
Right. So all we did, we actually removed all the heart bars. The first thing we did was we got rid of them because I tend to find with small feet like this, and they're quite weak. Especially on the hind feet, it's more about the width and the length, pulling the toe back, setting the shoe under. So not necessarily pulling the toe back, just setting the shoe under and ensuring there's enough width and length. So on the hind feet, which are the sort of the first picture and the third picture of the hind feet, we just put a normal shoe on. So we took it out of heart bars and we just put normal shoes on, and they just improved instantly. We just we trimmed the toe down, we spiral dressed the foot, so we trimmed the toe down. We just gave it more width and more length. So even though it had heart bars on, they were shod quite short. So in just 2 weeks, those feet had pulled those heart bars forwards, and they were then doing the opposite of what they should have been doing, and they were crushing the heels out more. And then in front, again, you can see the difference in the front feet are phenomenal, but that's more smoke and mirrors. So we didn't actually overdress the feet. We just we dressed the toe, so we pulled back the flare from the toe. I think the sides were quite nice anyway. We polished them up a little bit, and then all we done was we put a 3-degree pad on it. So only 3-degree graduation. So normally it come in graduated pads can be quite thick, so they can go in like a 5-degree, which is it's a lot really for such a small hoof. And we put some dental impression material in the back, so a little bit shock absorber, but also I generally use it to try and hold the back half of the foot in, so stopping the sort of bars and the and the back half of the foot from exfoliating, which gives you stronger heels. Because a lot of the time what people forget is you have to trim the heel down to make it better in the long run. So it's easy to make heel, but it's hard to make heel in the right angle. So these 3 degrees just meant that we could trim a little bit more off and just square the toe up. So we basically, so 45 minutes later, obviously with the backing of the vet, I got to go as mad as I liked, and that was the result. And we were really pleased with him. And you're saying about time earlier, I think the following day he was instantly sound. So, and because of that, I think he only lost 2 shoes in the whole 10 weeks he was with us, which was phenomenal. As you can see from the photos how overshot they were.
And Phil said to me, whatever I'm putting on, you're going to have to go find them if he loses them. And I turned him out in the world's biggest field and then regretted my choices instantly, because I thought if he loses the shoe, this is a good couple of hours of my day gone every single day of the week, the next how many weeks. But then he literally, the horse was then on the equivalent, I think, of like £2 a day worth of feed rather than £100 a week, plus grass, plus ad lib forage. And this was him before shoeing at 5 weeks. And it was just the amount of
so these x-rays were 5 weeks after I'd shot them.
Yeah.
So they've improved so much. And
what sort of time frame, Phil, would you allow for, or would you encourage people to give and have in mind when you're embarking on a project like Bob, to get it to how well you want it to be?
It's all necessary, I think. So Bob, actually, I think the first time, so those x-rays were taken at 5 weeks, and I think I didn't shoe him till the end of that week. So he was about 5.5 weeks. And then the following time, he was nearly 6 weeks. So we're very lucky because Lou has so many horses, and the fact that my daughter's horse is a livery on her yard, I'm up all the time. So each horse can have its individual shoeing cycle. So we do run a 4-week lot, we run a 5-week lot, and we run a 6-week. I don't believe that horses should ever go more than 6 weeks, just purely because I think horses can hold shoes on for longer than 6 weeks, but they should never need to be shod longer than 6 weeks, because you're looking at more of the foot balance and the trimming of the foot. A lot of the time, the ones that go a lot shorter don't actually grow that much foot. It's just easier to change the shoes and just keeping the toes back. But yeah, so we just individual. They're all completely in. So some of the Farrier go 5, some go 6. None go 4, funnily enough. But yeah, so we just try and treat them all individually. And I do that everywhere I go. We try and, every horse we look at, we try to just treat them individually.
And then in terms of the longer term, what would it take? What's the sort of time frame to get them to how as good as they're ever going to be kind of feet? Are you thinking, is that 6, 9, 12 months sort of time frame to think of to prepare for that?
Yeah, so it takes a year to grow a whole new hoof. So if you've changed the feed, and because normally it is people, I do believe people just overfeeding their horses on lots of special feeds that they can get from like £100 a week on some sort of magic feed. It takes a year, so I normally say within sort of the first 8 months you want to see quite a big difference, because then you've got the healthier hoof growing down, so that the hoof above my nail holes from the original chewing will be grown out. So all the hoof above my nail holes from that point should be good hoof, good strong hoof. If it's not, then some horses, they just don't grow good feet. And that's something that people need to understand, is you can't fix everything. Some of them just don't grow strong enough foot.
Yeah.
But then as their posture changes, you're not loading the front feet. So I think sometimes it's easy to blame the breed, but if they're comfortable everywhere else and you're not letting them run onto their forehand and you've got them stronger throughout the body, they don't smash the front feet. And I think, I think, I don't want to speak for Phil, but I think Phil probably sees a change in the horse's front feet, as in they can hold shoes longer. The quality of the foot's better, isn't it? Because they're not compressing.
I think it's the long toe, low heels. I think people are completely convinced that every thoroughbred in the world has long toes and low heels. But if you look at a thoroughbred's conformation, they have quite a long pastern. So they're going to have a long foot underneath. You're not going to have a short pony foot underneath quite a long pastern. So I think it's more about, we tend to use quite a lot of smoke and mirrors. So I'll put a shoe on unclipped instead of putting a clip on, because it's very hard to judge a toe if there's no clip for a reference point. very tight, very rarely to use side clips, unless they spin them off, unless a yard like ours where when one of them gets out, the other 20 want to go with them. So there's horses galloping everywhere. So we use side clips to try and hold the shoes on. But I'd much rather use a toe clip or a unclipped shoe.
And Lou, just from your perspective in terms of the musculature and sort of changing their physique and their way of going, what sort of timeframes are you looking at, and what are your sort of tips for helping to get them to how you want them to be for the job that you're going to ask them to do?
I think the first year to 18 months is going to be your most testing. But if you can get through that first year to 18 months, I think you're then well on your way after that point. I think if you're looking to do anything exciting or adventurous in the first year to 18 months, I feel like you could possibly be quite disappointed. I think also how you work these horses and like really taking into consideration where they naturally want to be and naturally want to sit. So like with some of the like there's this thing of also like long and low, which I think also needs to slightly do a bit of a ditch because these horses aren't built to be uphill or engaged. So like here, I don't know. This was like, I think it's really easy to like let them run too low, and then when you're running them too low, their bottom goes up in the air and they're still running down. So I think about these horses not having to use their necks to balance themselves, being comfortable enough, being able to think about the pole staying at the highest, like the pole staying in line with their wither and going no lower than that. Then it allows them to lift up and come through, and then you see the development quicker. It's when we're pushing them past that conformational point that we get into training concerns in the first year, 18 months.
And actually, we had a question early on in terms of, do you think these ex-race horses need to be ridden sort of every day, or I suppose this probably relates to their future career, can they be purely pleasure horses? But when you're retraining them, what's your sort of typical amount of work that you would do when they've just come out of training?
So for me, horses are maximum in work 5 times a week, but it's a kind of like don't have them under saddle once, twice, like in the arena, and then they're long reining, they're hacking. Like I think they don't need to be working every single day. Absolutely not. Don't agree with it. 5 times a week maximum. I think in the early stages we need to be more off their back than on their backs. And I think also it's just finding the balance for the horse. If the horse needs longer in the long reins, they get longer in the long reins. I think if they like are good and go like fine under saddle, great. But I think most of these horses are actually very happy being pleasure horses. And I think sometimes our own expectations of having to compete them to do whatever to deem it a successful retraining is slightly unfair on the horse and our expectations. Most of these horses that like, actually, to be fair, I know far more former racehorses that are happy hackers and low level riding club horses than ones that have gone on back into sport and elite level sport, because again of the conformational challenges, their first career. It doesn't mean that it's not possible. It's just, again, horse and rider combination. I've had some horses that I've looked at them move naturally and thought, wow, you'll be a phenomenal dressage horse. And then their body is just slightly caught up with them and all the years of racing, and they've just never really reached on. Whereas all of my horses I've got to advanced level, whenever I first met them, when they first came out of racing, I've kind of thought, oh, what am I going to do with you? You're a bit, and they've gone on to like the highest of high levels, and it's definitely never judge a book by its cover, because they've all really shocked me. All of them have shocked me. And I'm like, okay, you really have no set mold as to what's going to work and what's not. Sorry, very long.
One last question before we go back to Emily, because I do want to make sure that sees her picture in her head. But just one last question: do you have any products or equipment, anything that you would recommend as a sort of thing that you wouldn't be without in your tack room, feed room, whatever it might be, veterinary cupboard, for these sorts of scenarios and these horses?
Neck strap.
Neck strap. Body protector.
like neck strap for training as well as staying on. Neck straps are the way forward. It teaches you where the horse's balance is and what the forces are happening on it, and stops us pulling on their heads. Neck strap.
Perfect. Phil, do you have any products, supplements? items, anything that you would say you wouldn't be without as a top piece of advice?
Silver feet. We love silver feet. Our yard especially, but yeah, silver feet is the best. It's the best hoof balm ointment you can get, I think, and it's lasts forever, and it's not massively expensive. But yeah, it sort of coats the feet in an ugly goo that all your farriers all hate because it blunt their rasps. But that's an amazing job.
Brilliant, thank you. And Emily, is there anything you'd not be without? Probably different from a veterinary perspective, but
I'm only laughing because the other day I had a riding lesson without stirrups, and the lady said to me, "Do you want the neck strap?" And I was like, "No, I'm absolutely fine." And then about 1 minute later, I fell off. So that would have been good advice if I'd listened to Lou at the time. No, I haven't got a simple answer to that. I wouldn't. Do you know what I wouldn't be without is without, like you guys have said, different people to ask for advice from. I think that's the most important thing. That having the backup of, like everyone said, the whole team, you know, people experience like Lou in the retraining, good farrier, good physio, not going it alone. I think that's the thing.
Definitely, and there is a lot of help and resource available out there if you are thinking of rehoming a racehorse or retraining a racehorse or both. Brilliant. So while we just have a little look at maybe some questions behind the scenes, Emily, we obviously wanted to run this webinar not just because it's National Racehorse Week, but because you have an epic challenge ahead of you for a very worthy cause. So I think over to you to tell us a little bit more about it and probably share the video, I think, because it's just an amazing thing.
Yeah, so Katie and the guys at Denji are amazing people, and they're always supporting us. And I'm involved with this really exciting adventure with a friend of mine who is disabled, and she set up her own not-for-profit organisation called Equine Paradventures, and she's embarking on trying to be the first disabled woman to ride across the Andes next February, and I'm lucky enough to be going as part of her support network. So if I can just show you, I'll just try and show you the videos. I think it explains it the best. I don't know actually if I might have to play it without being. Can you hear it if I play it like this? Can you hear it, Katie?
I will be the world's first para equestrian to traverse the Andes, reaching heights of 4,400 meters and covering this incredible crossing from Argentina to Chile.
We've been told to expect all the seasons in one day. It's going to be rocky, it's going to be steep, it's going to be slippery, challenging water crossings on horseback and camping every night in the open.
Oh, I think we might have lost the sound. Has it still got sound at this point, Emily? Or
yeah, you not hear it? I don't know.
No, it's just cut out on the sound for some reason.
Or was it started? Did it show it to start with?
Yeah, and then it stopped. I don't know why.
Isn't it? What about
Can
you hear that now?
And was subsequently diagnosed with a neurological disorder. I have been in a wheelchair since then, lost use of one of my hands, as well as having lots of other really complex symptoms to deal with.
I'd never met Steph before, but I'd heard many things about her. I'm inspired by the way that she deals with pain and she deals with her disability.
Although Ride to Independence is a big challenge on horseback, what it's going to offer is evidence of how capable disabled people are and what can be achieved if you have the right support around you.
We are a team of 6 very independent, very strong-willed and amazing women. We all have our own very interesting backstory, but I feel like we beautifully represent the genuine women and the struggles that we all face silently behind the closed doors. But we're coming together to prove that the impossible is possible.
I think what's really exciting about taking on this challenge is the fact that it's just supporting people we don't normally do an adventure.
What I want to do in the future is be able to give other disabled people who are riders like me the opportunity to go and have absolutely epic adventures.
I think we should inspire a new expeditionary spirit in the outdoors that's inclusive to all. I really believe that putting all the skills together, we will be able to overcome all the challenges facing us and cross the Andes together as a team.
So yeah, I just very grateful to Katie and the guys at Denji for supporting us. And Katie's always brilliant at supporting all these sorts of challenges. It's a big privilege to be part of this. I'm not a brilliant rider, so someone like Lou would be much better suited to this challenge than me. I am quite scared. I'm going to try not to die. In the middle of the busiest thoroughbred time of year, I'm taking 10 days off work, which I'm sure everyone said was fine. They may not feel like that in February. So if you want to follow us, these are all our links and things, the QR codes to our GoFundMe page. But follow us on socials and tag along. It's really going to be an exciting adventure. So be part of it and follow us as we go on our journey. And thanks again, Katie, for always supporting us.
Oh, not at all. It's my pleasure. And I've had the pleasure of meeting Steph, and she's such an inspiration, just in the sort of face of adversity, just carrying on regardless, and then setting herself a huge, huge challenge. So we'll be watching with interest, and best of luck for that trip. But yes, I think there's just a couple of questions. I'm conscious of timings and keeping you all late, but let's just see if there were a couple more that came in, if there's anything. Does anyone, I thought this was quite interesting. I don't know, Phil, whether you would know about this in terms of what would the shoeing routine be when a racehorse is in training? Is it very different?
I believe I've never worked in Newmarket, but I went to college with somebody that did, and I believe that each yard's particular, so they have a farrier that goes in and sort of not necessarily has a list, but he goes around and checks them to see what he decides needs shoeing, when it needs shoeing. Obviously, they'll change the plates, the trainers, into aluminium plates for racing. So I think it could be as little as every 4 weeks, I imagine.
Yeah. And are they, one question that came in when you were talking about pulling shoes off, is that by overreaching, or is it just the balance that's out of kilter and they just come off? I guess
any shoe that's pulled off is from overreaching, unless they're pulling it off in the fence. It's always down to overreaching. So it's having that front limb slow down a little bit for the hind limb to catch back up. And then it's obviously treading the back of the shoe.
Brilliant. And then again, I don't want to set you off on a whole other area, Lou, but someone has just asked specifically about exercises that are good to build up back strength and top line. Would you suggest pole work and raised poles, just to cover off those last ones?
Yeah, anything that gets them to bend and flex a joint. So if you think like there's more water treadmills now available than there ever have been, which are great, but it kind of activates the same kind of muscular kind of and bending of joint and activation of everything. So anything that they're not built to be active through the joint. So to be a good racehorse, you want not very bendy like knees and hocks. You don't want like spider action, because then it leads them to greater soft tissue injuries when you put that into fast work. So that's why you see loads going into showing. So then to create that activity, going over poles, raised poles, it gets them, using themselves. Walk poles are actually the most beneficial rather than trot poles, because the horse then can't deviate onto a side because each limb's doing something different every single time. But yeah, the more you can get them bending and stepping, but using themselves as they go over the pole, because going over a pole inverted with their neck in the air doesn't really help. You feel like you're doing the right thing, but it doesn't really do anything apart from reaffirm. Put your back down, stick your neck up. Brilliant.
Right. I think that's probably all of the Q&As that we can answer. Oh, hang on. Maybe just one more. We'll see if we can cover that one off. Where did that go?
There was one saying about weight and this time of year with weight gain, and I will just put it out there that we've had no rain and the grass has been a real trickster this year. So anyone that's panicking about weight gain, it has been lack of rain. I can't believe I live in the UK and I don't like that we haven't had any rain. Rain.
Yes. I think the feeding ones we'll cover off and get a bit more detail. The team will get onto those tomorrow because we've got all your details and things and conscious of time. So it just remains for me to thank you all very much indeed for a great discussion and some really useful insights, practical advice, and some top tips. So thank you. Thank you for giving up your evening, and hopefully we'll see you all soon.